A 75-year-old man has history of falls 3 times in last 3 months. He is a known diabetic patient. Now he is in your hospital. Your task is to take focused history and perform focused clinical examination and then manage his concerns. So introduce yourself, check patient's identity, then tell him the agenda of today's meeting. Then try to find out the cause behind his history of falls. There can be a lot of things that can cause a patient to fall repeatedly. So you need to establish the exact cause as soon as possible. So you can start by asking him, when did this happen, and do you think you lost consciousness when you fall down? What exactly happened before you fell down? What happened during and what happened after? Did you notice any seizure? If the patient don't understand what is seizure, you can tell him any abnormal movement in your body, any water work or tongue biting after the fall. Did you receive any injury? Did you notice any abnormal heartbeat? Do you have any problem in walking? Any problem in bowel motion or water work? Drug history is also important because polypharmacy can be a cause of fall, or if the patient is hypertensive, then too much antihypertensives can cause fall. Too much anti-diabetic medication may also lower the blood sugar. So ask him about his drug history, any drug allergy, diabetes control status. Then ask about vision. Do you have any vision problem, any blurry vision, any problem in your color vision? Can you distinguish between red and green traffic light? Do you bump on objects when you walk? To check for tunnel vision. Ask about diet, any history of wearing tight clothing, because tight collars can put pressure on carotid arteries. Since the patient has diabetes, so ask him about peripheral neuropathy. Do you feel any pins and needles over your legs? Do you feel like you are walking over a layer of cotton? Do you feel any imbalance? Do you have high stepping gait? Then move into the focused examination. First, do the general inspection. Is there any obvious muscle atrophy or any obvious injuries? Then ask the patient to walk to assess gait. Please be careful so that the patient does not fall during your examination. Also ask the examiners that you would like to know his blood pressure while lying down and after standing. If possible, then do the fundoscopic examination, and if you see a fundoscope available nearby, then it is a good indication that the patient may have some findings in his eyes, because diabetes can cause diabetic neuropathy and also cataract. Next, you can ask the examiners that you would like to perform the finger prick blood glucose check. Generally, you don't need to do this type of test in PACES exam. The examiners should happily tell you his random blood sugar count. Then look for any signs of proximal myopathy, tone, power and reflexes of his lower limb. Then if the time allows, you should do some cardiac examination, at least check his pulse to identify any arrhythmia, and also listen to his heart sound, specifically for aortic stenosis. You should also take some social history because this is an old patient. So you need to ensure that there is a caregiver looking after him. So you can ask him about who helps you at your home, about other family members. Are they doing great? Do you drink? Do you smoke? Or do you need any support in your family life, social life, or regarding your finances? Next, explain the patient the cause of his falls and then offer the appropriate management. In brief, let's consider this patient has postural hypotension due to uncontrolled diabetes. So you can tell him that the cause of your repeatedly falling down may be related to your long-standing uncontrolled diabetes, which is causing your blood pressure to suddenly fall down when you stand up from a lying or sitting position. I think this could be a reason for your repeated fall down. However, we need to do the complete history taking, physical examination, and attach you to our multidisciplinary team to further investigate on this matter. If the patient has vision problem or any history of seizure, then talk briefly about DVLA rules. Ask him how would you return to your home today and offer him to call a taxi for him. Examiners may ask you about the management of a patient with history of recurrent falls. Tell them about multidisciplinary team approach. The patient will need assessment by a occupational therapist, physiotherapist, optometrist, pharmacist, nurse, and geriatrician.